I feel that Primobolan is highly worth it. Assuming it's pharmaceutical grade, I would pay an arm and a leg for it. Maybe that's not you. Maybe you suffer from hair loss. Maybe Primobolan is not worth it. But we have alternatives on the menu. Vigorous Steve here. Let's play a little game called Worth It or Not. Just like a natty or not, to assess whether somebody's drug-free or enhanced. But in the context of this video, we're going to discuss whether injectable steroids are worth it or not in the bigger picture. Now, I understand that the worthiness of a particular injectable steroid is highly contextual, right? My personal experience might not represent your personal experience with a particular compound, but based on my personal experience and all of the coaching which I've done over the years, I think we can make a pretty comprehensive list whether particular compounds are worthy of use or not, whether that's contextual, in which particular setting, which dose, right? We're not going to discriminate between esters, right? Because testosterone, for example, has a multitude of esters, and other compounds might only have one or two esters, which in most cases merely influences the administration frequency, the serum concentrations, and the tendency for post-injection pain. Before we get into all of that, please like the video, leave a comment for the algorithm, and consider subscribing. If you haven't already, please hit the notification bell button so you can get notified every time a new video drops. Let's start with the tried and proven compound that you already produce naturally to a certain extent, being testosterone. Right? We're not going to discuss the esters. Is testosterone worth it or not? Now again, the context here is highly dependent on your age and your experience. If you haven't been bodybuilding for such a long time, and you do your blood work and you see that your natural testosterone production is middle top of the reference range, and you don't have so much demand on your body physically, I don't think testosterone, exogenous testosterone that is going to be worth it. If you're 15 years old and you're thinking about cycling, obviously none of the steroids are going to be worth it. But if you're, let's say, 50 years old and your testosterone production has been declining, TRT, testosterone replacement therapy, hormone replacement therapy, starting at 125, 150 milligrams per week, is certainly going to be worth it. As a bodybuilder, if you're actively competing, or a recreational bodybuilder, or a gym rat, and you want to go dabble with anabolic androgenic steroids, testosterone is also going to be worth it because that forms the foundation of your cycle. So the dosages are going to go from, let's say, 100 milligrams per week upwards, and how high you can tolerate the dose of testosterone up until that breaking point, that kind of makes it not worth it anymore. Now, the funny thing is about testosterone, you can mitigate a lot of the side effects with ancillaries, which we'll make a separate video about in this Worth It or Not series. For me personally, I was able to ramp up the testosterone dose to 2,000 milligrams per week. Would I do that nowadays? No, because I have no real interest in running such high dosages, but I have done so in the past. And all I needed was testosterone and an aromatase inhibitor. Most of my blood work was reasonably acceptable for this dose of anabolic androgenic steroids. And again, that's my personal experience. It might not be representative of your experience with testosterone. I just want to give you an indication of the very wide range in dosing protocols when it comes to testosterone, which highly depends on individual response. Now, regarding individual response, of course, why testosterone is demonized is because it converts into dihydrotestosterone, and some people who are prone to male pattern baldness will experience baldness and hair loss faster than without exogenous testosterone in the picture. You can mitigate that with some ancillaries, but for some people who really don't respond well to testosterone due to hair loss or acne or anxiety or unmanageable blood pressure, and these side effects manifest at any dose, those non-responders might be better off with a nandrolone-only cycle. Again, it's a little bit difficult to manage because you still need to fulfill some sort of estradiol in your bloodstream. Again, nandrolone-only cycles generally end up with subclinical estradiol levels, so you might need an ACG on top or DHEA and pregnenolone to supplement neurosteroids to get somewhat adequate levels of estradiol or oral birth control, right? It gets complicated fast. So if you're a non-responder to testosterone or you get unmanageable side effects at any dose, clearly testosterone is not going to be worth it for you. For 99% of the people out there, I would say that testosterone is worth it, albeit in the context starting at hormone replacement therapy and ramping up the dosages to whatever you can tolerate, and then looking elsewhere if you want more anabolism on top of the anabolism that you get from your testosterone. Moving on to Boldenone. I feel that Boldenone is worth it, also contextual, predominantly in the off-season. Again, Boldenone has been used on top of a testosterone base for decades now, in the context of an off-season. Dosages that I consider to be worth it range anywhere between 300 milligrams per week up to 1200 milligrams per week, at which case you see that most people start to experience terrible side effects. Right? Their hematocrit starts to go up. Their blood pressure might be a little bit too high because it's also dose-dependent response of the steroids that they're taking. In most cases, you will probably have a 1-to-1 ratio of testosterone to boldenone because it is known to suppress estradiol levels by acting as a reversely binding aromatase inhibitor, occupying the aromatase enzyme, preventing testosterone to convert into estradiol. So there might be a 1-to-1 ratio depending on your body fat levels and your injection frequency. Let's say you're running a gram of test and a gram of boldenone in the off-season, assuming that you're phenomenally developed and you actually need such a high dose on top of your caloric intake. Beyond that, most people would already start to experience sleep apnea, blood pressure issues, elevated hematocrit to the point they need to donate frequently or need to do monthly blood donations. I can't say that boldenone is worth it during a contest prep. Some people start their contest prep or cutting phase off with boldenone. Again, we do know that it's a quote-unquote dry compound because it doesn't aromatize into estradiol and suppresses the conversion of testosterone into estradiol. That being said, I do know several people who prefer to run their cutting phase or contest prep predominantly on boldenone as their primary source of anabolism. They might run a testosterone base in the form of hormone replacement therapy or a little bit more, let's say 300 milligrams of test per week and 900 milligrams of boldenone on top, and perhaps some other compounds later on as they get leaner and leaner and leaner. And boldenone is the highest dose anabolic in this context, but for them it's obviously worth it because they don't get so many side effects and they can replace spending extra money on Primobolan by using boldenone instead. So like I mentioned in the video comparing boldenone to Primobolan, even though I feel that Primobolan is superior, if you don't have access to Primobolan or it's simply too expensive, boldenone might be a suitable replacement. So in that context, replacing Primobolan with boldenone, it's highly worth it for particular people that don't suffer from the side effects. But there is some clinical evidence, some animal studies, that boldenone has been linked with kidney toxicity. Now, from all of the blood work that I've seen with younger guys, older guys that ran boldenone for years or decades, there's no indication of kidney toxicity. Still, the evidence is there, so that's something you need to keep into consideration. You can't really go by anecdotal evidence of a couple guys that don't have any issues with their kidneys because, well, everybody is biologically different and their tolerance might be your downfall. So keep that in mind. The evidence is there that boldenone potentiates some kidney toxicity. That's something you need to keep it in mind. And for some guys that have poorly functioning kidneys or maybe a hereditary condition regarding their kidney health, I would say that boldenone is not going to be worth it for you, right? Too many potentials for long-term side effects. And again, you could replace boldenone's anabolic effects and increase for hematocrit production if you do so desire with a compound like Primobolan, right? So let's move over to Primobolan. Is that going to be worth it? Yes, absolutely. But availability and price and tendency that Primobolan is faked makes it not worth it. So you need to be a little bit more resourceful in that sense, right? You need to be financially secure and you need to be able to source pharmaceutical Primobolan or have access to a reliable underground lab that brews their products properly. That being that the product is sterile, is accurately dosed, contains the active pharmaceutical ingredient as labeled. So if it says Methenolone annotate Primobolan on the bottle, that's what it should contain and only contain. Nothing else, no Masteron or Boldenone, nothing else to mask the low dose of Methenolone annotate that they actually used to produce their product. Right? Proper carrier oil, for fuck's sake. Sesame, grapeseed, cottonseed, castor oil, or MCT oil, and nothing else besides some benzoyl benzoate and benzoyl alcohol, no ethyl oleate. None of that synthetic garbage that will send your inflammatory markers to the moon and will only come down if you actually stop using this shit. Right? If you have access to reputable underground labs, that might be a suitable replacement for Bayer Primobolan. Then it's highly worth it. At any dose. Still contextual, because if you suffer from hair loss and you're prone to male pattern baldness, it's probably not going to be worth it. It might be better to, again, look somewhere else or stick with the nandrolone-only cycle. But if you're prone to androgenetic alopecia, male pattern baldness, and already experience hair loss while using testosterone as a base, Yeah, Primobolan is going to make that a lot worse. And it doesn't matter what dose you're running, whether that's 100 milligrams Primo per week or 1,000 milligrams Primo per week, if you can even afford that, right? Assuming that it's legitimate pharmaceutical grades, you'll experience hair loss at any dose. And from my experience talking with people who are prone to experience hair loss on DHT derivatives, it doesn't matter how much shampoo you take or research chemicals or, well, 5-alpha reductase inhibitors, but I'm sure everybody realizes that those only work in the conversion of testosterone into dihydrotestosterone and don't prevent the conversion of Primobolan because it's already a dihydrotestosterone derivative, right? So you would need to block the androgen receptor in the scalp with research chemicals or shampoos. And from my experience, most guys would still experience some sort of hair loss, especially at higher dosages running Primobolan. So there's a little bit of micromanagement involved if you still want to run Primobolan on top of your testosterone base and you experience hair loss, right? Because you feel that all of the other options are not worth it to you. Right? And otherwise, you do what I did. You trim your hair, right? It highly depends on your preference because, well, let's be honest, the Skeletor look certainly isn't for everybody. I do feel that Primobolan is one of the most versatile compounds of the injectable compounds we can choose from, besides testosterone, which generally speaking, people run the longest. There's a testosterone base and compounds like Primobolan go on top of that. What I brought to the forefront is that I find ideally a 1-to-1 ratio. Of course, you might need to adjust this ratio depending on your estradiol levels, because similarly to Boldenone or Masteron, Primobolan acts as a reversely binding aromatase inhibitor. So you do need to do your blood work frequently. Again, if you dial it in and you have an ideal ratio based on your injection frequency and your body fat levels and your individual aromatase enzyme expression, once you figure all of that out, you can basically run Primobolan in most of the settings that we undergo in bodybuilding or for fitness aspirations, whether that's in the off season or a contest prep or a cutting phase, even as part of a cruise. So you don't need to use an aromatase inhibitor, basically a low dose testosterone and a low dose Primobolan, let's say 150 milligrams a test and 150 milligrams of Primobolan. It's not TRT, right? There's no P in TRT. There's no P in hormone replacement therapy. Primobolan is a synthetic compound, a testosterone derivative modified to something that's not generally found in nature. But I do know people that like to do their cruise on testosterone and Primobolan and basically nothing else and get decent blood work for the couple months that they do their cruise like this. Again, I feel that Primobolan is highly worth it, assuming it's pharmaceutical grade. I would pay an arm and a leg for it. Maybe that's not you. Maybe you suffer from hair loss. Maybe Primobolan is not worth it. But we have alternatives on the menu. But let's stick with the dihydrotestosterone derivatives for a bit and go from Primobolan to Masteron. But I don't think that, or no, let me retract that. I know that Masteron isn't particularly hair safe. And just because I don't experience hair loss on Masteron, not being prone to male pattern baldness, I don't get hair loss from any steroids. The only hair loss that I got was from cerebral lysin because it contains brain-derived neurotropic factor, which induces hair loss through a different pathway, right? And that's mostly happening here. That's one of the reasons why I trimmed my hair, besides that it's so hot in Thailand. But just because I'm immune for hair loss due to anabolic androgenic steroids doesn't mean that Masteron is going to be safe for you, especially if you suffer from male pattern baldness and androgenetic alopecia is in your genetic makeup. Just look at your parents, whether it's your grandparents, your dad, your uncle, whatever. If you see a little bit of balding and shedding anywhere on the scalp, avoid Masteron. Really. Or if you don't care about balding, well, of course you can use Masteron at your own leisure. But if you do care about it, I would generally avoid it. From everything that I've seen, Masteron is the worst on the hairline, and I would rather run Primo instead of Masteron, because like I discussed in the Primobolan versus Masteron video, even though both potentiate hair loss and suppress estradiol conversion, Primobolan is certainly a better mass builder compared to Masteron on a milligram for milligram basis or a molecule for molecule basis, right? I'll link that video at the end of this one. Will Masteron put muscle tissue on you? Yes, of course. Otherwise, Masteron wouldn't have been discontinued in medical settings where Masteron was prescribed to treat estrogen-positive breast cancers in women, right? The muscle-building effects, the virilizing effects, the androgenetic effects of Masteron were undesired when prescribed to women. That's why selective estrogen receptor modulators and aromatase inhibitors became preferred in these treatments. Don't get me wrong, Masteron will put some muscle tissue on you, albeit not to the extent of the other anabolic androgenic steroids that we can choose from, whether those are injectables or oral steroids. You will build some muscle tissue on Masteron, but look at it this way. Masteron should be considered an add-on on top of testosterone. Testosterone is the sole provider of anabolism, and Masteron complements the testosterone, prevents the conversion or reduces the conversion of testosterone into estradiol, mitigates some of the water retention, polishes the physique, reduces some of the electrolyte imbalance that testosterone might cause and some of the other compounds might cause. And this way, you get an increased cosmetic effect. And whether that's a testosterone plus Boldenone base with Masteron on top at a low dose of 200-300 milligrams per week, or testosterone and Primo with a low dose of Masteron on top, or a contest prep cycle with testosterone Primo, Trenbolone at a low dose, and then Masteron in a low dose on top, perhaps in a 1-to-1 ratio to Trenbolone, which seems to prevent Trenbolone's effect regarding thickening of the skin because it does potentiate some collagen synthesis through the progesterone receptor pathway. Right? You have collagen synthesis through estradiol pathway, progesterone pathway, and a side effect of most of the progestogenic 19-nors, being nandrolone, tresolone, or Trenbolone, is that they thicken the skin. And it seems that Masteron is able to mitigate this to a certain extent by reducing the collagen synthesis that estradiol potentiates on the skin, right? Will you get super thin skin? No, you need to take the progestogenic 19-nors out, making them not worth it during a contest prep setting if your skin needs to be paper thin. But right, Masteron is a worthy add-on, and that's the only way I would look at it. Don't look at it as a suitable mass builder. Don't look at it as, well, I'm going to run a gram of test and a gram of Masteron and build phenomenally huge muscles like a gram of testosterone and a gram of Primo. But Primo is too expensive. Primo is not available. I don't want to use underground lab Primo, even though Masteron is also underground lab. Right? It's mostly cost effective in this context. You will build a lot less muscle tissue on that combination compared to a combination of Test and Primo. Right? A lot of things to consider. I don't feel that Masteron is worth it during the off season. If you suffer from side effects from testosterone, somehow you came to a conclusion that a hormone replacement therapy dose of testosterone of 200 milligrams per week, because that dose doesn't really give you any side effects, and then the rest of your anabolism is coming from nandrolone. Let's say 500 milligrams nandrolone per week, up to 1,000 milligrams of nandrolone per week. Again, that's dependent on what you want out of your cycle, how much you can tolerate, and what your level of development is. Maybe in this context, 200 to 300 milligrams of Masteron would be beneficial, again, to keep the water weight off, reduce the conversion of testosterone into estradiol, which nandrolone is a cofactor for. It actually upregulates and promotes the conversion of testosterone into estradiol because nandrolone is a metabolic intermediate in the conversion of test to E2. And in this context, Masteron would actually help to mitigate that, keep the skin a little bit thick, make you cosmetically more appealing, not look like a bloat monster on this particular cocktail, right? It's very contextual, and maybe 1% of the people would benefit from such a protocol. Still, in that context, it's worth it. But if you're suffering from hair loss, and if you have access to real Primobolan, I don't really consider Masteron to be worth it from a muscle building perspective, but it can be a worthy addition on top of all of your other injectable compounds which are running for your muscle building aspirations, in which case Masteron is purely or mostly a cosmetic enhancing drug. It makes you look better, makes you look more streamlined, makes you look less bloated, right? Whether that's during the off season or a contest prep, which is highly desired during a contest prep. But for muscle building purposes, well, you better look somewhere else. And you know what, guys? I think I'll leave it here because this video is already way too long. So stay tuned for part 2. I know we're skipping over the progestogenic 19-nors like Trenbolone, Nandrolone, and Drostanolone, but I will handle those in the second part. I'm trying to keep this YouTube algorithm friendly. The algorithm is brutal, so I can't make these videos too long. And in the second part of the injectable compounds, whether they are worthy or not, I'll also discuss Clostebol and Stenbolone and perhaps dihydroboldenone. I don't really have experience with these compounds, but I feel that I have enough anecdotal results of clients and people that I've talked to during consultations to give these compounds a worthy or not rating, so to say. Right? Stay tuned for that. We'll probably drop that out over the next couple of days. Which compounds are worth it for you? Right? Whether that's a dose dependent or contextual, in particular settings, right? I only like mint up until 50 milligrams and beyond 50 milligrams. It's a horrible compound. Just for an example, please let me know down below in the comment section. You can find everything that I'm associated with in the description section. It's between this video and the comment section. So while you're halfway there, you can find my website. You can find my ebooks, where to get in touch with me for consultations, my Instagram account, my TikTok account, all of the sponsors and affiliates that I'm working with. Right? While you're on your way to the comment section, glance over there. Maybe you can save yourself some money in the process using one of my affiliate links and discount codes. A front double bicep for the Vigorous crew. A little bit of injectable compounds in these cannons, but they're already metabolizing. And I think in a week or two, everything is cleared from my system. And then I'm just on ACG monotherapy, which I didn't include in this video. We'll save that for the injectable peptides a couple videos down the line, right? Thank you guys so much for watching. Stay tuned for part 2, and I'll see you in the next video.